Hello, I'm Jesse Holcomb. I'm a registered nurse first assist in surgery here at Pullman Regional Hospital, and today I'm going to be participating in a health tech talk regarding the SI Da Vinci robotic surgical system for the Center for Learning and Innovation here at Pullman Regional. The Da Vinci SI model that we have was originally created around the year 2000 by the military for use remotely, because essentially their idea was to be able to have a patient anywhere in the world be brought into a surgical suite, and then a surgeon, with a particular surgeon for any given situation, could log in remotely and complete a surgery on a patient without having to physically be there. It was a great idea, and I think it would have been useful for that application, and it probably was used for that application for some time. But once it hit the open market and people really saw that this would be a technology and an innovation that would work well in hospitals, we began to see it across the nation and across the world. I brought you over here briefly just to show you the surgeon console that is actually where the surgeon sits and performs the surgery, remotely controlling the robotic arms in the patient. They do so by putting their fingers through these little devices down here, got one for each hand, that then of course remotely controls the arms inside the patient, allowing for precise surgical technique to be carried out. The unique thing about this system are a few things actually. Number one being that while the surgeon is looking through this console, they are under a 10 times magnification, allowing, of course, for increased precision with their techniques. Also, it has 1080p 3D stereoscopic vision. So really the depth of tissue that a surgeon is able to see and the level of detail that they're able to see compared to standard laparoscopic surgery is on another level, quite frankly. And that is where we ultimately get a lot of patient advantages and better outcomes for patients that undergo robotic surgery, because generally speaking, while the surgeon is able to increase their precision and do their job a little bit more proficiently, the patient then, of course, is the benefactor of less blood loss, far less pain, because generally we only have to make small incisions to get the instruments into the abdomen and perform, or wherever the target anatomy is, and perform the surgical procedure. And then of course also the time with which the surgeon has to take to complete the procedure is usually far less, and therefore just a better recovery for the patient overall. So our patient outcomes and satisfaction with these procedures in particular have been very, very positive and successful. I think largely due to those factors that I just named right there. And finally, I just wanted to bring you over here to show you the Robotic Tower, which is where the main motherboard or CPU, the brains of the operation, is housed. We also use it to store our electrical generator, other devices as well that work in concert with the robotic system throughout surgical procedures. It also, as you can see, has a monitor that gives us a direct portal or eye into what the surgeon is seeing exactly, and lets us work in concert with them, of course, fluidly throughout the procedure as well. This innovation and technology, the Da Vinci platform, has been very exciting for all of us that work here at Pullman Regional, especially in surgery, of course, and has benefited the community and the patients that we serve here tremendously. I know that right now Pullman Regional, and has been for several years, looking into the upgraded version, or the XI, and that will be very exciting to see if we get that in the future, what kind of jumps and leaps we can make with healthcare delivery here in Pullman, and from our institution right here at home. So again, my name is Jesse Holcomb. It's been a pleasure bringing this little quick talk to you on the Da Vinci SI robot that we have here at Pullman Regional. On behalf of the Center for Learning and Innovation, I just want to thank you for your time, and also please, if you have any more questions or are more interested in any of the health tech that we use here at Pullman Regional, please log on to Pullman Regional websites, the Center for Learning and Innovation website, under Health Tech, and we can have many more videos there waiting for you so that you can delve into all the exciting things that we have going here at Pullman Regional. Thanks again. We'll see you soon.